So welcome to the show. I have a great pleasure of introducing our guest today, Dr. Michael Edelstein, and he has over 40 years of experience of practicing REBT, and he has written 4 books, the most popular one being 3-Minute Therapy. And the most important thing, he has learned REBT from the master himself, that is Dr. Albert Ellis. And it will be a great interaction, I hope. Hi, Michael. Welcome to the show.
Hi, Niraj. Thank you for inviting me. I look forward to our discussion. And I do want to say for your new viewers that REBT stands for Rational Emotive Behavior Therapy. It's an approach to psychotherapy devised by Albert Ellis, a genius in the field in the 1950s, and changed the entire course of the psychotherapy movement from the more Freudian-oriented type of therapy where you discuss your childhood to get over your emotional problems today, to cognitive behavior therapy, which is the popular brand these days, which says that your emotional problems come from your thinking now in the present, and that's what causes your emotions. And what causes your emotional problems is thinking in terms of demands, must, shoulds, supposed to's, have to's. And there are the 3 main categories of demands are a demand on oneself. I must do well and get approval. And if I don't, I'm no good. And that leads to anxiety, depression, and guilt. The second is a demand on others. You must treat me fair, kindly, rationally, reciprocally, lovingly. And if you don't, you're no good. And then the third area is an impersonal kinds of demands, not a demand on oneself or others, but a demands on situations, your life. My life must be fair, easy, and problem-free. And if it's not, then that's awful, that's terrible, my life is miserable, I can't stand it, and I have to escape in addictions or procrastination, or even worse, commit suicide. So if you have an emotional problem, anxiety, depression, anger, and look at your thinking, what's my demand, what's my must, what's my should, and show yourself that all demands are fictions. There's nothing that must happen. Reality is reality, not what you think it should be. And work on changing your thinking to just preferences. I prefer to do well. I prefer you treat me well. I prefer my life to be easy and interesting and successful. But there's no reason why these things must take place. Does that make sense, Niraj?
Yeah, great. I have been a student of REBT, and these ideas really changed my thinking towards looking at everything in life. So, Michael, great. So I think I have a couple of goals for this interview. Shall I just spell out that for you?
You have what for the interview, did you say?
Goals. Couple of,
yeah.
One is...
before we get to the goals, I wanted to mention one more preliminary thing.
Yeah.
And you said I studied with Albert Ellis, and I just wanted to elaborate on that. When I was 18, I had all kinds of emotional problems, depression, anxiety, procrastination. And I was in college, and I was about to get kicked out because I was failing my classes, procrastinating on studying. And I was fortunate enough to come across Albert Ellis. I lived in New York at the time, and that's where he lived, and that's where he practiced was. And that dramatically changed my life. So
great.
I'm very fortunate to have met him.
Yeah. So in fact, that was my first question. So you briefly told about your journey with REBT. So can you add something more about that how you started, how you met Albert Ellis, and how it transformed you, how it changed you, and how you got into your own practice. So can you tell more about it?
Yes. What happened was when I met Albert Ellis, I went to a lecture he gave And I was in psychoanalytic oriented therapy at the time, where you talk about your relationship with your parents, your childhood. The therapist was very warm and accepting, and his main intervention was, tell me more about it. And since, as a depressed 18-year-old, it was nice to have someone who was unconditionally unconditionally accepting of me, and didn't criticize me as I had been doing to myself. And so I felt better during the sessions. But between sessions, I didn't have anything to do to help myself. So when I started feeling my usual anxiety or depression, I didn't know what to do except to look forward to my next session with my therapist, when he would be compassionate and caring. And then I went to a lecture by Albert Ellis, and he criticized this type of therapy and said, you feel better, but you don't get better. So actually, I went to his lecture with my sister, and she immediately started seeing him and was doing much better, and said to me, Michael, why don't you start seeing him also? Because you're not getting anywhere in your therapy. So that's when I started seeing him. And I was in group therapy most of the time with him for actually about 6 years, 5 to 6 years. I was in group therapy, and then I continued to practice on myself after that. And one of the features of this kind of therapy is you learn to be your own therapist. You learn to identify your problem, disturbance creating thoughts. You learn to question, challenge them, and contradict them, and make inroads into them. And there are various ways to do that. One way I call a 3-minute exercise, where you write out, and we could discuss this more in detail at some point.
We will definitely discuss that.
Where you write out your irrational thoughts and questions.
So this was at the institute Albert Ellis founded. You in which year you went to him?
He founded, well, at first he was in private practice without an institute, and then he founded an institute. First it was called Institute for Rational Living, and then later on, after a few name changes, it became the Albert Ellis Institute.
Because now I'm segueing to my next question. So therefore, I just wanted to know that in which year you went to him for therapy.
Which year? I was 18, so that was, I was born in 44, 54, 64. So I started seeing him about at 1963.
Great. So my next question to you is, because I think in 55, 56, he gave his first presentation in Chicago, if you remember. And
his first published paper was 1956.
So my next question to you is, you have witnessed that era where there was tremendous influence of personal centric therapy and Freudian psychoanalytic, and it was a revolutionary idea then. And the whole community, psychology community, was quite hostile towards his ideas. So I would really like to know that a perspective, because I assume you witnessed that era from when he introduced that idea, and he just pushed it through relentlessly. So I would like to know your experience, that how hostile was the environment, and how he tackled that, and how REBT, or the cognitive revolution, came into existence. So can you tell more about it?
It's fascinating. A one-man revolution, because of his persistence and unabashed advocacy of his approach. And I was when I first came across Albert Ellis and his ideas, I was working as a social worker in the mental ward of a hospital in New York. And one of the main comments I got from some of the psychiatrists there, that I talked to over lunch
Mhm.
about these ideas,
Mhm.
that criticism was, oh, that's too intellectual,
Mhm.
by which they meant that just working on your thinking isn't really deep. Deep
Mhm.
therapy works on discusses your childhood, where your problems really come from.
Mhm.
And one of their large mistakes is they were confusing people's genetic predispositions
Mhm.
with
Mhm.
their upbringing.
Mhm.
So
Mhm.
we all have a predisposition to
Mhm.
escalate our preferences into demands and
Mhm.
create emotional disturbance for ourselves.
Mhm. Mhm.
Um, but uh, but they looked at it as your childhood, what you
Mhm.
learned from your parents,
Mhm.
not your genetic predispositions. And you
Mhm.
call that the seen and the unseen. The
Mhm.
seen is how you raised as a child, that your parents
Mhm.
criticized you or things
Mhm.
like that. The
Mhm.
unseen is your genetic predispositions
Mhm.
to crooked thinking.
Mhm.
And we all have that, and that's
Mhm.
why it is difficult
Mhm.
to uproot our thinking, our irrational thinking, the musts and
Mhm.
shoulds,
Mhm.
because we're
Mhm.
working against these genetic predispositions and against our environment and what we learn.
Yeah. Yeah.
So, so that's something to take into account. That
Yeah.
if you have difficulty overcoming your disturbance,
Mhm.
part of it is you're genetically predisposed to think
Mhm.
irrationally, and
Mhm.
that's one of the reasons not to blame yourself. Don't condemn yourself for your
Yeah.
depression, anxiety, uh, and to look at the things you can change and you can influence.
Yeah, yeah. So, Michael, before going into the 101 of REBT, I just want to finish this part. And if you can just give some anecdotal instances or some historical perspective of how, as I was asking you, that when he started this revolution and how, what were the major landmarks and how it became a mainstream idea. Like it became a mainstream idea in the 70s, 80s. Can you just comment on that, or maybe some anecdotal instances?
Yeah, yeah. So as we've said, that one of the main influences was Albert Ellis himself,
Yeah,
but other therapists started to adopt some of his ideas. And
yeah,
one of the main ones was Aaron Beck
yeah,
at the University of Pennsylvania.
yeah.
And Aaron Beck had an MD,
Mm.
and Albert Ellis had a PhD.
Yeah,
And on the pecking order, an MD is considered more official than a PhD.
yeah, yeah.
So uh, Beck became somewhat influential, and he started with an approach he just called cognitive therapy. And
Mm.
it was, I would call it a superficial REBT, where he
Mm.
came
Or
up
a
with
non-elegant REBT.
non-elegant REBT,
Yeah.
exactly. Yeah. And so what he did was he looked at people's distorted, what was called distorted thinking,
Yeah, yeah, yeah.
and correct that, but
Mm.
not look at the deeper underlying factors like
Mm-hmm.
demands. So
Mm-hmm.
as an example, someone goes out on a date
Mm-hmm.
and decides that say it's a male, decides that the woman he went out on a date with didn't like him because she seemed frowning and not very responsive during the date.
Mm-hmm.
So 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 CBT would say, well, how do you know that she
Mm-hmm.
was frowning and non-responsive? Maybe
Mm-hmm.
she's a quiet person, maybe she's depressed. We don't know. How do you
Mm-hmm.
know?
Yeah,
Whereas
yeah.
RBT would say, well, that's worth questioning, but
Mm-hmm.
how come you assume that
Mm-hmm.
because she responds this way, it means she doesn't like you, she's rejecting you?
Mm-hmm.
And how come you don't think, well, maybe she's depressed, maybe she's
Mm-hmm.
a reserved person, things like that? And
Mm-hmm.
the answer is because underneath your assumptions about why she's responding that way is
Mm-hmm.
your demand. I absolutely need her approval. I'm a loser. She doesn't approve of me. And when you have a absolute, like a need or demand, then
Mm-hmm.
that leads you to focus on its absence.
Yeah,
So, for
yeah.
example, if someone has a fear of flying and they have a demand, I must have a guarantee the plane won't crash. That must will lead them to think that the slightest turbulence on the flight means that the plane's about to crash.
Yeah, yeah, yeah.
So, that's what was the difference between Aaron Beck and Albert Ellis's approach. And Aaron Beck, as I was saying, because he was an MD, tended to catch on much more quickly.
Yeah,
But,
just I want to jump in, and one question I want to ask here.
Yeah.
And so do you think that some of the REBT concept, like directly attacking the root of the problem, may feel threatening or may feel radical to some of the community, and CBT was more what you can say, it's more maybe superficial but more smoothing, so it got more popular because it was giving a rope, long rope to individuals.
It seemed more acceptable.
Yeah, yeah.
Yeah. I don't really know, but again, I think that people were more likely to respect Beck because of his MD and his position in the university. And he had a research arm also in the university that did research on what he was doing. And Albert Ellis really didn't wasn't a research psychologist. He was just a clinical psychologist.
Correct.
And his theories were basically from what he observed about people and what he knew about philosophy. For example, one of the basic ideas in REBT comes from Epictetus, which is it's not situations themselves that cause our emotions, but rather it's our thinking about situations. So Ellis's approach was more philosophical than research oriented, and just based on his own formulations, based on his wide knowledge of philosophy and other and earlier psychologists also. He borrowed from Alfred Adler. And
Karen Horney.
What's that?
Karen Horney.
Yeah, Karen Horney.
Yeah.
And those were two of the main ones, I think, and some others. Also from Stoicism, as I mentioned. Also from semantic.
Martin Seligman.
What's that?
Martin Seligman was also.
Martin Seligman came after Ellis. I think Martin Seligman got a lot of his ideas from Ellis.
Oh, okay.
Yeah. Oh, yeah. I was thinking of general semantics. Have you heard of general semantics? Korzybski had looked in people's thinking and its influence on their emotions and behavior. So Ellis borrowed some from Korzybski also. So before getting into the 101 of REBT, do you want to add anything as per the historical landmark? A specific question is when REBT got its due in terms of popularity, when it got established. Would you like to comment, and then we'll proceed to the 101 of REBT? It's my impression it was more gradual than a high point. Because of Ellis's persistence, genius, and getting the word out. Yeah,
great. So now I have to move to the next question, and which is I would like you to give our viewers insight into kind of 101 of REBT, the basic concept, the basic premises, and how it can help you. So will you let us know that? Yeah. So a very good way to answer that, Niraj, is through what I call the 3-minute exercise, or some people call the ABCs. And this is sort of a roadmap to where your disturbance comes from, what causes it, and what you can do about it. So it starts with A, activating event. So let's say the activating event is you're fired. You have a job and you're fired. And you're depressed about that. So for the sake of clarification, we'll skip B for a moment and go on to C. C stands for undesirable emotional consequences about A. So A, you're fired. C, you feel depressed. And intuitively, it seems like being fired causes your depression.
but that's not how our emotions work. It's B that causes C, not A. B is your irrational beliefs about that, which in this case could be something like, I must not be fired. I can't stand being unemployed. This proves I'm a loser. So that's B, your irrational beliefs. So A, the activating event is you're fired. B is you're telling yourself, I must not be fired. I'm a loser. And that causes C, your undesirable emotional consequences, depression. So that's the A, B, C. Before we go on to D, E, and F, did you have any questions about A, B, and C?
No, please proceed.
Okay, so A, B, and C was diagnosing the problem, which may be irrational thinking. And then D, E, and F is self-treatment. And D stands for disputing or questioning your irrational belief. So that just involves looking for the evidence for your irrational belief, being somewhat of an empiricist or a little scientist. What is the evidence that I must not be unemployed? This proves I'm a loser if I am. So just ask the question, look for the evidence, do a thought experiment. Is there any evidence for your demands, for your must? And if you think about it, you're never going to come up with evidence for must, because all demands are fictions. They're anti-reality. So the answer at E is, the question is, no evidence that I must not be fired. Reality is reality, not what I think it must be. Although I prefer to be employed, there's no reason I have to be employed just because I prefer it. I don't like being unemployed, and I don't like being fired, but I can stand what I don't like. And it's not, and then reminding yourself also at E, effective new thinking, it's not the my being fired that's my emotional problem, but rather it's my thinking about it, my irrational must thinking about it, and I can change my thinking.
Great.
And learn to unconditionally accept myself as the imperfect human I am, even in this unfortunate state of affairs. And then finally, once you convince yourself of that, which takes practice, then that leads to F, a new feeling, which would not be a positive feeling. You don't want you to be happy about being fired, but it would be a negative feeling, but an appropriate or adaptive negative feeling, such as concern, frustration, great disappointment, regret, but not depression or hopelessness. So if you look at that, B causes C, the must causes your depression, not the situation, and E causes F. Changing your thinking, giving up your demand, leads to a more appropriate adaptive kind of feeling.
Great. So that makes sense. That really makes sense. So do you want to add anything in terms of giving the illustration about REBT, or shall I ask you further questions?
The only thing I'd like to emphasize, not add, is in order to change your thinking, it's not a silver bullet or one trial learning. It takes practice, identifying your demands, questioning, challenging them, showing yourself again and again on a regular basis. And I teach my clients these 3-minute exercises they can write out once a day, twice a day, 3 times a day, the more the merrier, to work on changing their thinking.
Yeah. Great. So after listening to you, and now REBT and CBT is one of the evidence most researched therapies, I assume, is there. But what is the reason? Because there are still many objections. You talked about the objection which was raised in the 60s and 70s, but sometimes that objection is still raised by people today also, that it is too intellectual. It is thinking is superficial part, and the mindfulness therapies which have come, or Freudism after so much evidence that most of the things Freud said were wrong, still Freudism is in practice. People practice that. People believe that. So what do you think? What is the reason, and how you will answer to this criticism of REBT?
The criticism that it's too intellectual.
Yeah, yeah.
Well, the main thing is to look at the results that REB tends to help people get better in addition to feel better. So I would offer that the anecdotal information as the main evidence against it's too intellectual to be helpful. Try it. If you're skeptical, try it, give it a try, write out the streaming exercises a few times a day for a month. And I'll give you a money back guarantee that after the month you'll be doing better, feeling better, and acting better.
Yeah, yeah. So now I want to move to some technical questions about REBT. Will that be fine?
Yeah, very
Yeah,
good.
yeah. And one question I have is regarding the differences between CBT and REBT. And I think you have written a blog about that. So it will be great if you emphasize a summary about what do you think are the differences. Particularly one aspect which you highlighted earlier, that it's more philosophical. But apart from that, one aspect which I commonly see between CBT and REBT is CBT seems to have too many jargons and long processes like 10 distortions and various concepts which seems to be more complicated, or I sometimes things are made complicated just to make sure that the client gets into those concepts. But on the other hand, REBT seems to be more simple. The effort is made to make it more simple so that the person directly, efficiently gets to his root cause of problem and relieves that problem. So, would you comment on the main question and the side points?
Yeah, I think that's very well stated, Niraj, about the differences. So as you said, REBT is philosophical. It teaches you to change your whole perspective on yourself, others, and life. Whereas the CBT is more empirical and just saying, is it likely that this happened? Things like that. Also, REBT goes, in terms of being philosophical, it goes for unconditional acceptance, accepting yourself as the imperfect human you are, accepting others as the imperfect humans they are, and accepting life with its problems and frustrations. So we call that sometimes USA, unconditional self-acceptance. So that's a main difference.
Yeah.
Another main difference is in terms of how anger is viewed. And that is CBT often looks at appropriate anger and inappropriate anger. And that some anger is reasonable based on the situation, and other anger isn't, and some anger is okay if it doesn't get overblown. Whereas REBT says all anger is toxic and doesn't help because it tends to rip you up inside and alienate others. So you don't get anywhere positive with anger. But don't throw out assertiveness. You can still assertively express your opinions, assertively say what you want, what you don't want from people without anger. So that's another main difference. So those are a couple of the main differences there.
Yeah.
Can you think of any others?
Yeah, so would you like to comment on this aspect which I highlighted, that CBT has so many concepts, 10 distortions and other concept, the negative triad and all that. In that contrast, you can see REBT deliberately kept very simple, simple to understand, so that people can work on it and get rid of their emotional disturbance. So would you like to comment on that? The complexity of CBT.
Well, I think you said it very well, and that is CBT is much more complex, but REBT is much simpler. Go for acceptance, accepting yourself, accepting others, accepting life by giving up your demands. Really, that's REBT in a nutshell.
Yeah, so
So,
I just want to ask you this question, that how does it help therapeutically? That the REBT is designed in a simpler way and CBT is not, and what are its impact or implications? Can you comment on that?
well, I think the impact and implications is that REBT is easier to learn and it's easier to apply. Once you learn it, then it's a very comprehensive kind of therapy, and it applies to any situation in life and where you disturb yourself about it. So that's a lot simpler and not so complex as looking for 10 distortions and those kinds of things.
Yeah. So do you see any reason why CBT is made that way? Any specific reason you foresee?
Why what?
Why CBT was constructed that way, with so many concepts turned around? The basic REBT concept, it seems, have been turned around and packaged in a different way. So do you think any specific?
One of the reasons is, as we were talking about, Aaron Beck devised the CBT, the cognitive therapy, and he was more respected because of his medical standing. And the research arm. So that's one reason. I think another reason is that since REBT is more philosophical and people tend not to be philosophical, they tend to be more concrete thinkers, then a lot of people didn't resonate to it very much.
Okay, fair. Great. So I move to my next question, and that is regard to, I think you are aware of the huge self-help industry, which is now in existence. All the coaching and productivity and performance and success. Are you aware of that? There is a lot of books, self-help books coming in.
Oh yes, tons of them.
Yeah. And when you look deeper, many times you see the REBT, Ellis's ideas are propagated in a just slightly different way, and they are being popularized. So there are many authors, self-help authors. There are business coaches who in fact, we discussed one in one of our podcasts regarding Tony Robbins, who popularized the concept of how you can change your life, how to achieve success, and all those things. And what is the view of REBT on this new phenomena, the self-help era and the gurus who teach how to become successful and all that? So what is the REBT view on that?
Well, my version of the REBT view is that people are basically disturbed. Everyone has some emotional problems at the very least, and a lot of emotional problems at the very most. So people want to know how to get over these problems. And in addition to what you mentioned, Niraj, there's also a very large industry of drugs and medication for these problems. So people have, it just shows how widespread emotional problems are in people, because this is being human, an imperfect human. So that's why all kinds of industries have popped up to use their version to sell their approach to helping people. By the way, Niraj, if we may back up on something we were discussing earlier, and that is the difference between CBT and REBT. There are a couple I didn't mention.
Please go ahead.
Yeah. So one is the notion of secondary disturbance. I think REBT is the only approach that highlights secondary disturbance, and that is being anxious about being anxious. And often when a client says, I'm anxious and I don't know why, I can't think of any specific situations I'm anxious about. The answer is they're anxious about becoming anxious. So for example, they are scheduled to give a talk in a week and they have anxiety which is sometimes called free-floating anxiety. It was probably named that by people who don't understand secondary disturbance. And the way that might work in this situation is I have a talk to give in a week, and I realize I might be anxious at the talk. And now, a week before, I start getting anxious about being anxious at the talk. So that would be secondary disturbance or secondary anxiety. Anxiety about anxiety, and it's more abstract, so it's harder for people to identify that. And I don't think most therapists have identified it and look at secondary disturbance at all. Another difference that the other difference I didn't mention between CBT and REBT. REBT sees that negative emotions are adaptive, are appropriate if bad things are happening, but there's a difference between appropriate and adaptive negative emotions and inappropriate and maladaptive negative emotions. So REBT is not feel-good therapy, where no matter how bad things are, you feel good, but rather REBT says if things are bad in your life, it is appropriate to feel these appropriate negative emotions, but they come from preferences. I would like to be employed, and because I'm not, that's too bad, that's unfortunate, that's regretful, and that would lead to some negative emotions like frustration, disappointment, displeasure, but they would be appropriate to the situation.
So does CBT have a different view on this healthy and unhealthy negative emotions?
Yeah, I don't think CBT distinguishes between healthy or adaptive negative emotions and maladaptive negative emotions. And so I don't think they're aware of that difference.
Great. Anything else you want to add in terms of the distinction, or shall we proceed?
That was it in terms of the two more distinctions.
Now, one more question which I want to ask is about the homework, because you said that importance of homework given in REBT. And I think you said rightly that it's not a silver bullet. And now many new studies in neuroplasticity are suggesting that it is possible to rewire your brain. And Ellis was advocating at the time when there was no supportive evidence. So what do you think about that? Would you like to comment on that?
Well, I think since Albert Ellis devised REBT, there have been brain studies, brain imaging that gives some credence to what Ellis was saying. And one of them is that, as you said, neuroplasticity, which is you can actually change your brain through practice. And there have been studies of, for example, meditators that looking at the brains of people who meditate on a regular basis and people who don't, and you see growth in certain areas of the meditators that you don't see in the brain areas of the non-meditators, which shows that the brain actually changing your habits on a regular basis and changing your thinking actually has physiological effects on your brain.
Great. So do you think Ellis predicted this? That was a genius, that he could see that these are the things which are going to come in future, or these are the things which are important?
Oh yeah. I don't recall him ever mentioning the brain or what's going on in the brain or the prefrontal cortex or neuroplasticity. But I think what he said is given more evidence by brain studies.
Great. But just a side question: do you think he was aware of the all the aspects of the technical aspect of the brain and all those things, and he take cognizance of that, or he purely dependent on his anecdotal experience?
Well, he built on the shoulders of other people, but I don't recall that any of it had to do with the physiology of the brain.
Okay,
As
great.
we were discussing, some of the other people were Horney and Adler
Yeah,
and Epictetus and Stoics and those people.
yeah. Great. So now I want to go further and ask you about one of the important and controversial aspect of REBT, and that is empathy, and the importance given of on empathy, because psychological school uh, stresses on the importance of empathy, and it seems, correct me if I'm wrong, that Ellis was somewhat against empathy, giving empathy to the client, because he felt that it was counterproductive. So would you like to comment on that and the importance of empathy?
Yeah, and I'm glad you said you qualified that, Niraj, by saying somewhat against it. He
Hmm.
wasn't totally against it,
Yeah,
but he was against the idea that it was necessary to help people with their problems. And one of the clear examples he gave is that some people are helped with their emotional problems just by reading a book
yeah,
about this.
yeah,
And you don't get empathy from a book.
yeah.
So one of the main promulgators of the empathy idea was Carl Rogers,
Yeah,
who did client-centered therapy.
yeah.
And his idea was you get people over their problems just by reflecting back their thinking, reflecting
Mm-hmm.
back their emotions,
Mm-hmm.
expressing empathy. Don't say that any thinking is wrong or anything like that.
Yeah,
That would be off limits.
yeah.
And but research since then
Mm.
has shown that to be largely false. And one of the clear clear evidence of that, or result of that, is that I think there are very few therapists these days who call themselves client-centered therapists or Rogerian therapists. I don't think it's very popular at all. Is that your
Yeah.
impression, Raj?
Yeah. I also think so. We normally we don't see a client-centric therapy now, therapist nowadays. But
Yeah.
just one add-on question on that. So there are two views. What you meant, what I understood, what you're saying is that empathy is not necessary. That is more or less established. That's what you are saying. That is not a necessary condition in therapy. But
Yeah,
what is your
exactly.
view that I think Ellis had a view, and you comment on this, that empathy is not only necessary, empathy is not necessary, plus it can be counterproductive. So the second part, what do you think about that?
Oh, yeah. Ellis made a point of that, and that is if you show a lot of empathy
Mm-hmm.
and unconditional positive regard, the client could
Mm-hmm.
start thinking they need the therapist's approval
Mm-hmm.
because the therapist is so nice and compassionate and warm and positive toward them.
Mm-hmm.
So that would be a disadvantage of a lot of empathy. Also, it wastes a lot of time and money for the client if you're spending time on empathy and not and being allergic to identifying irrational beliefs and showing the client how they can change their irrational beliefs.
Okay. So with your clinical practice of 40 years, you now second it.
Oh, yeah. Makes sense to me.
Yeah. Great. So now I'm moving to the next question, and that is with regard to, as you rightly said, that so many people are emotionally disturbed in the world, and the depression and suicides and anxiety disorders are increasing day by day. So
I don't know, Niraj, if I may interrupt. I don't know if they're increasing day by day. I just think it's a pandemic, to use a popular term.
yeah,
That's the way people
correct.
are.
That would be more appropriate. So it is kind of a pandemic. And in this background, what if you were to summarize, what message REBT has to give to improve on this as a humanity? What would be the message of REBT in terms of changing these things, and in terms of my question goes like this, in terms of fulfillment, in terms of happiness, in terms of self-actualization. So there are two parts. One is reducing the disturbance, and the second part is improving your happiness, improving your fulfillment. So what message REBT has to give?
Yeah, that's a great question, Niraj. And then we talked about the first part, overcoming disturbance, but then just because you're not disturbed, that doesn't mean you're enjoying life. So the second part means recommends having a passion, having a goal that you're passionate about, and working toward that goal. And Ellis somewhat humorously said, if you like war, work for war. If you like peace, work for peace. So find a passion. What do you enjoy doing? And then immerse yourself in that. So that would be the positive part of enjoying life after you address your emotional problems.
Okay. So in nutshell, let go of your demands and find a passion and work towards it.
Yes, exactly.
Great. Now, talking of passion, I knew that you were a libertarian, a proponent of liberty. Am I correct?
Yeah, that's correct. And that's based on the non-aggression principle, which says it's wrong to initiate physical aggression or coercion, the threat of it, against other people. But I don't think that there's a necessary connection between REBT and that, but that's more my political philosophy.
Yeah. And with that regard, I want to ask you two questions. One is with regard to Ayn Rand, because the libertarian community is somewhat influenced by her, and you have a different opinion about Ayn Rand's concept of self-esteem. I think, and one more question is regarding objectivism. What is your view on her total philosophy? So two questions. One is, can you just comment on her view on self-esteem and in general about her philosophy of objectivism?
Yeah. And I've debated some Randians on self-esteem because they think high self-esteem is a good thing, and I think high self-esteem is toxic. And what that means is to esteem something means to rate something highly, which is fine, which is very good to rate things highly that you like, and other things not highly, and avoid those things. But then self-esteem rates your behavior, which is good, and then generalizes it to yourself as a total person, rating your total person. I'm a good or I'm a bad person because I do well or do poorly, and there's no evidence that the evaluation of your actions equals you. All we could say about your essence or your personhood is you're an imperfect human who acts imperfectly. You act well at times, you act poorly at times. Sometimes people will like you, sometimes people will dislike you, but all through that, you're still the same imperfect human. And that's unconditional self-acceptance. And it gives up rating yourself and gives up self-esteem. So that's the main problem with self-esteem.
Yeah. And would you like to comment about her philosophy of objectivism? Were you influenced by the great book Fountainhead and all that?
I enjoyed her book, Atlas Shrugged, but I thought she was an excellent fiction writer. But I wasn't influenced by that.
Okay.
In fact, I went to a debate between Albert Ellis. This was in 1969, I think.
You were there? You were there for that debate?
Yeah.
Oh, okay.
Albert Ellis and her main acolyte, which was Nathaniel Branden.
Yeah.
So that was the debate.
So that brings another point, is that after that debate, I think Ellis wrote a book. Is objectivism a religion?
Yes.
Yeah, but then he also said that libertarianism is also religion. So what is your take on his view of that?
Well, his view was any rigid view that you don't look for evidence or is not falsifiable is a religion. but his one book was Is Objectivism a Religion?
Mhm.
And then someone else named Jimmy Walter
Mhm.
wrote took pretty much what was in Objectivism as Religion and retitled it as Libertarianism as Religion, because
Okay.
Jimmy
Okay.
Walter didn't agree with libertarianism. But if you read the book,
Mhm.
he doesn't mention libertarianism at all. You might find one reference to
Oh.
libertarianism
Okay.
in
Okay.
Jimmy
Okay.
Walter's book
Uh-huh.
called Is Libertarianism a Religion?
Okay. Okay. So the title was reframed.
Yes, yes.
Oh, okay. Great. 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 Yes, so thank you very much, Michael, for this interaction. It was really insightful. One more information which I would like to share with my viewers is that Michael has a YouTube and podcast channel, 3-Minute Therapy. So if you are interested more in this approach and you want to learn more about REBT, then you can subscribe to that channel. And thank you very much, Michael.
Yeah, you're welcome. I wanted to add a few things to that, Niraj.
Yeah.
One is the podcast is called 3-Minute Therapy Podcast.
Yeah.
And just about every week, often with a REBT partner, we discuss a subject related to psychology and REBT.
Great.
And by the way, if you, Niraj, or anyone else would like to be a guest on the podcast, let me know. And you can find my contact information through my website, 3minutetherapy.com. And also I have a popular book about REBT called 3-Minute Therapy.
Mhm.
3 is the word spelled out. And you can find more information about that on my website, 3minutetherapy.com. And thank you very much for having me.
Yeah.
And I am in practice now, and I do remote therapy most of the time,
Mhm.
Zoom, Skype, FaceTime.
Mhm.
So if you're interested in becoming a client, send me an email at Dr. Edelstein at 3minutetherapy.com, and I'd be happy to discuss it with you.
Great. So this was valuable information. So whosoever is interested will contact you. And thank you very much, Michael, for those insightful answers. And hope to see you soon. Thank you.
Yeah, and thanks for the insightful questions. They were very, very good questions.
Yeah.
And very probing.
Yeah. Thank you.